Hey everyone, my name is Doreen Rael. I just wanted to touch base with all of you, um, especially those in the therapy, counseling type of healthcare. I wanted to just go over the difference between gender and sex. So, sex is something that you are biologically born with, it's the genitalia that's between your legs that classifies you as a male or a female. Whereas gender puts you as the way you live your life, the way you see yourself in your mind, the way you live your lifestyle. If you live your life as a male or female, some don't classify themselves as either or. You have those that were biologically born male, but they identify themselves as female, and vice versa. Now, we have a hard time in the clinical settings for therapy, um, because there's different bias to each gender. Women are always mostly seen as always on an emotional roller coaster, their emotions going up, down, sideways, back and forth. And there's more women that are diagnosed with clinical depression, for example. Whereas you have males that are taught from our society that it's not okay to discuss your feelings and you shouldn't be sad. You should never show your emotions. You should never cry. There's less males being diagnosed with depression because they're not seeking treatment, they're not seeking help. And then you have those who are too afraid to seek any help, and that's our transgender, our LGBT community, that they don't receive adequate health care because they don't see themselves identifying as what their genitalia basically and society wants to see them as. The reason that we need to look at these patients is the fact that they're not getting the adequate health care needs met because of society, doctor, anyone. They feel uncomfortable with it. So if we're uncomfortable with it, then our patients are going to be uncomfortable with it, and that's unacceptable. We need to make sure that we are providing the adequate care for any patient, regardless of sex, gender, identity, anything like that. There are huge risks to not taking responsibility and caring for our patients. The fact that the doctors take Hippocratic oaths to do the best of their ability, but they're really not if you can't be comfortable with a patient. So there's risk factors that happens when you're not comfortable. If they're not coming in, they're not getting that preventive care that they need. They're not talking to somebody about how to handle things that they're seeing in our society. Risk factors could be harming themselves, harming others. We've seen it in the news, terrible things happening to people that for these kids, these adults, these males, females, transgenders that didn't seek the appropriate treatment. So that's where we come in. It's an epidemic that's happening in our society, that these people are needing clinical diagnoses, clinical treatments for depression, because let's face it, if you are having a hard time identifying or proving to society how what you feel in your heart you totally are, I mean, it's an unfair thing to go to. So if you can't even express your feelings and have somebody help you get through them because the therapists, the doctors, they don't feel comfortable, then we're failing, and we're failing our patients. So one thing that we need to do is we need to educate. We need to educate professors. We need to educate doctors. We need to educate our staff. Anyone that comes in contact with patients, even over the phone, we need to do better for them. We need to have training videos. We need to hold training classes. I mean, we need to speak to people. The one thing that we need to do is get out there and see what's going on. It's becoming more and more part of our social norm for the LGBT community. There's more coming out because now it's more socially acceptable, so it needs to be more socially acceptable in healthcare settings. Too often times they feel discriminated against, and nobody should ever feel discriminated against when it comes to healthcare, because we're all human beings and we need to engage with them, find out what they're comfortable with. We need to get comfortable in our own self. We need, even if we do different types of therapy sessions, things like that. I know there's drug developments for testosterone and estrogen. And then even those that identify themselves as the same as their genitalia. I mean, men, women, they have the same right to equal care. And we as a community, it's our responsibility to bring them that adequate care and just have an amazing healthcare system. We live in the greatest country in the world, and if we can't even get our health care right to make our patients feel comfortable enough to come and see us and seek treatment, we're just gonna fail. Thank you.